The Lowell Thomas Award for Radio News has been won by the team of David Barron, Sheri Fink, and Patrick Cox of PRI's The World for their global look at rationing healthcare. All the way from Boston, please welcome David Barron and Sheri Fink.
Thank you very much. This award really belongs to Sheri Fink more than any of us. In fact, the series was built around Sheri. It was just a year ago that Sheri won a Pulitzer for work she'd done for ProPublica and the New York Times. We at The World had worked with Sheri before, and we were keen to do so again, and I wanted to see if I could snag her for another project. Sheri's first reaction was she'd love to, but she was busy, she was writing a book, but I persisted, and I said, well, what if we built a project around what you want to write about? What do you think we should do a series on? And her response was that she wanted to look at the allocation of healthcare resources in other countries. Now, it wasn't the most exciting sounding topic at first blush, but we talked, and I came to realize that this really was an important and undercovered topic. I mean, we've been hearing a lot tonight, very movingly, about deaths from war and political strife and natural disasters, but what about deaths due to bureaucratic decisions in healthcare? So we came up with the idea for the series, and for two of the stories, Sheri and I actually traveled together, and it was early in our trip to South Africa that I really saw the dire consequences that can come from decisions about medical resources. Sheri and I visited a small hospice outside of Cape Town. It was on the grounds of a church, and inside we met with a 43-year-old mother of three named Karen McPherson. Karen tidied her hair for us, and she tried to smile, but she was weak. The best she could do was whisper when she spoke to us. She was terribly nauseous, and she was dying because her kidneys had failed. Now, her condition was perfectly treatable. In fact, here in the US, Karen would have gone on dialysis, she would have regained her strength, and she would have gone back to have many fine, productive, happy years. And South Africa also provides dialysis to people, and there was a local hospital with a dialysis clinic. The problem was that those in charge of the budget had decided that they could only allocate so much money to that clinic, and that left the doctors to choose who would get the limited treatment slots, literally to decide which patients would live and which patients would die. And Karen, unfortunately, did not get a treatment slot, and 2 weeks after we met with her, Karen died. I remain haunted by our meeting with Karen, and I'm grateful for the time that she gave us on one of her very last days of living. I'm tremendously grateful to Sheri Fink, who is the smartest and hardest working journalist I know, for conceiving the series, for serving as its lead reporter, and also as co-editor of the other stories. I also want to thank our colleague Patrick Cox, who couldn't be here tonight, and our web team in Boston. And thank you very much to the Overseas Press Club for this great honor. Thank you.